Hi WEvolves, are you suffering from any of these? Let's move into today's topic. There are numerous ailments that are classified as mental illnesses. The following are some of the most frequent types. 1. Anxiety disorders. People with worry disorders experience fear and dread in response to particular things or circumstances, as well as physical indicators of anxiety or panic, such as a racing heart and sweating. An anxiety disorder is diagnosed when a person's response is inappropriate for the scenario, they are unable to control their response, or their anxiety interferes with their ability to operate normally. Generalized anxiety disorder, panic disorder, social anxiety disorder, and particular phobias are all anxiety disorders. 2. Mood disorders. Also known as affective disorders, are characterized by chronic feelings of sadness, times of excessive happiness, or swings from great happiness to extreme sadness. Depression, bipolar disorder, and cyclothymic disorder are the most common mood disorders. 3. Psychotic disorders. Psychotic disorders are characterized by altered perception and thought. Hallucinations, the perception of unreal pictures or sounds, such as hearing voices, and delusions, incorrect fixed beliefs that the ill person accepts as true despite evidence to the contrary, are two of the most common symptoms of psychotic diseases. A psychotic disorder such as schizophrenia is an example. 4. Eating disorders. Eating disorders are characterized by the severe weight and food-related feelings, attitudes, and actions. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. 5. Impulse control and addiction disorders. People with impulse control problems can't control their urges to do things that are potentially damaging to themselves or others. Impulse control disorders include pyromania, starting fires, kleptomania, stealing, and excessive gambling. Addictions to alcohol and drugs are very frequent. People with these disorders frequently become so engrossed in their addictions that they neglect their obligations and relationships. 6. Personality disorders. People with personality disorders have strong and rigid personality features that are distressing to them and/or cause issues at work, school, or in social situations. Furthermore, the person's thought and behavior patterns are markedly different from societal standards and are so inflexible that they interfere with the person's regular functioning. Antisocial personality disorder, obsessive compulsive personality disorder, histrionic personality disorder, schizoid personality disorder, and paranoid personality disorder are all examples of personality disorders. 7. Obsessive compulsive disorder, OCD. People with OCD are troubled by intrusive thoughts or concerns that lead them to undertake rituals or routines. A person with an irrational fear of germs who washes their hands all the time is an example. Obsessions are uncontrollable ideas, and compulsions are rituals. 8. Post-traumatic stress disorder, PTSD. PTSD is a condition that can develop after a traumatic and/or distressing incident, such as a sexual or physical assault, a loved one's untimely death, or a natural disaster. People with PTSD are typically emotionally numb and have persistent and frightening thoughts and memories of the event. Other, less common types of mental illnesses include the following. 9. Stress response syndromes, previously known as adjustment disorders. These are less prevalent types of mental illnesses. When a person experiences emotional or behavioral symptoms as a result of a stressful event or situation, they are said to have developed stress reaction syndromes. Natural disasters, such as an earthquake or tornado, events or crises, such as a car accident or the diagnosis of a serious disease, or interpersonal issues, such as a divorce, the death of a loved one, the loss of a job, or a substance abuse problem, are all examples of stressors. Stress reaction syndromes normally start 3 months after a stressful event or scenario and conclude 6 months after the stressor has stopped or disappeared. 10. Dissociative disorders. People with dissociative disorders have substantial problems or alterations in memory, consciousness, identity, and general awareness of themselves and their environment. These diseases are frequently linked to extreme stress, which might be the outcome of traumatic events, accidents, or disasters that the individual has experienced or observed. Dissociative disorders include dissociative identity disorder, commonly known as multiple personality disorder or split personality, and depersonalization disorder. 11. Factitious disorders. These are conditions in which a person deliberately and purposefully manufactures or complains of bodily and/or emotional symptoms in order to put themselves in the role of a patient or someone in need of assistance. 12. Sexual and gender disorders. These include problems with sexual desire, performance, and conduct. Sexual and gender disorders include sexual dysfunction, gender identity disorder, and paraphilias. 13. Somatic symptom disorders. A person with a somatic symptom disorder, also known as a psychosomatic disorder or somatoform disorder, has physical symptoms of illness or pain that cause an excessive and disproportionate amount of distress, regardless of whether a doctor can find a medical cause for the symptoms. 14. Tic disorders. People with tic disorders make repetitive, fast, sudden, and/or involuntary sounds or non-purposeful body motions. Vocal tics are sounds that are made involuntarily. A tic disorder such as Tourette's syndrome is an example. Other diseases or conditions that involve the brain, such as numerous sleep-related issues and many kinds of dementia, including Alzheimer's disease, are frequently regarded as mental illnesses. Well, if you or your friend is struggling with these symptoms, the best solution is to have the proper guidance from a medical practitioner prior to any other options you've left with. Thanks for watching. Subscribe for more videos.